I don't want to interrupt your lunch, so go on eating. I'm Alice Rivlin, and I have the privilege today of interviewing Suzanne Mettler. I am deeply grateful to the Academy, not for the first time. I'm deeply grateful to the Academy for introducing me to Suzanne. For some reason, I had not discovered her before. And discovering Suzanne is a very welcome experience for reasons that you will come to appreciate. Suzanne is a political scientist. She is the Clinton Rossiter Professor of American Institutions, that sounds very important, at Cornell University, where it is doubtless colder than it is here even. And she has written on higher education, on democracy and inequality, and other subjects. She writes provocatively and lucidly at the same time, which is pretty good for an academic. The reason we are talking today is to explore the ideas in her book and a couple of subsequent articles called The Submerged State, How Invisible Policies Undermine American Democracy. So, Suzanne, let's start with that title. It sounds kind of ominous. There are these hidden policies that endanger our form of government. That sounds like scary stuff. So what are you talking about? What are these invisible policies? Why are they invisible? And why is this a danger to democracy?
Okay. Well, first of all, I'm delighted to be here, so thank you all for coming. And I'm thrilled to be having this conversation with Alice, who I so admire and with whom I share so many common interests. The submerged state is a term that came to me as I was studying how we do governance in the United States, looking at lots of different kinds of policies and about citizens' reactions to them and the very different kinds of reactions that interest groups have and so on. And it came to me that submerged is a way to describe them. And this is what I mean. I'm referring to policies that instead of government directly doing something, that it channels its activity through the market by giving subsidies to groups or individuals to do something on its behalf. And most of my work is about social welfare policy, very broadly understood. And so in this area, the main game in town is tax expenditures, doing things through the tax system, which is actually spending in the tax code, but doing things like the home mortgage interest deduction or the tax-exempt status of employer-provided retirement benefits and health care benefits, where people receive benefits, but government's role in providing them is not really clear. Instead, it looks like the market is doing something and individuals are doing something for themselves. But in fact, it's a way of government creating social policies. And so, you might say, well, what's the difference between this and a direct social policy? From an accounting perspective, there's really no difference because both of them present costs to the federal budget. So whether, if you take housing, for example, whether you're giving people subsidies and government is writing the checks to them, or whether you give people the home mortgage interest deduction and government collects less in revenues as a result, it's either way you have the same effect, is that it's a cost to the federal government. So in accounting terms, it's the same. It's also the same in that both of these kinds of policies are created as social policy where government wants to do something for some group that is deemed worthy and for some purpose that we think is good for the public good. But somehow it comes off very differently to citizens generally. They perceive it very differently, it turns out, if it's done through these more submerged channels.
Let's follow up on that because you've got some really interesting survey data that proves this last point, which I found absolutely fascinating, about how people answer when asked about their use of a government social program. Tell us about that.
Yeah. Okay. Well, I did a survey in 2008 where the very first question that people were asked was, have you ever used a federal government social program? And we didn't define it. We didn't say what it was. And, you know, mind you, we're calling people while they're cooking dinner. We're lucky they're staying on the phone. And we're getting, you know, kind of their first crack at an answer at this question that hits them cold. And they say yes or no. And it turns out that just 43% of people said yes, they'd ever used a federal government social program. Then we went on later in the survey, and you know, these good people stayed on the phone with us for 20 minutes, and we asked them eventually about 21 specific policies. Have you ever used unemployment insurance? Have you ever used Social Security? Have you ever used the home mortgage interest deduction, and so forth and so on? And it turned out that 96% of people had used at least one of these policies at some point in their life. And the 4% who hadn't were, for the most part, young people who hadn't yet had an opportunity to do so. You know, it's very interesting to find that it's much more common that people use social policies than we might think. But then we looked at, well, who said no and who said yes at this first question. And the people who are most likely to say, no, I've never used a government social policy, but actually had used something, were people who had used one of these policies that I call this part of the submerged state. They had used these various policies that were in the tax code, hidden in the tax code, and therefore it didn't strike them when that term is used that what they had utilized would be in that category. The people who were most likely to say yes were, interestingly, people who mostly had used programs for low-income people. And we've probably come to think of that term, government social programs, as being associated with programs particularly for low-income people, welfare and food stamps and the like. But then I've done a lot of other work with the data from this survey, and I get away from using that first question, which in some ways is maybe a little unfair. You know, as I said, it uses a particular term, and you catch people cold. But I look at instead adding up the number of visible social policies people have used over time versus adding up the number of submerged policies they've used over time. And then I look at how that influences their different attitudes. So for example, if you ask people, has government ever helped you in times of need? The more visible programs people had used, the more likely they were to say yes. But the more submerged policies they used, it had no impact on how they answered that question. And if you ask people, has government provided opportunities for you to improve your standard of living? It was the same thing. People who, the more visible policies, the more likely you are to agree, but no impact if you'd used more of the submerged policies. And then very interestingly, we asked a question about the fairness, whether people, their attitudes about tax fairness, if they thought the tax system was fair, or they're paying too much or too little. Well, people who had used more visible policies were more likely to say that the tax system was fair than those who'd used fewer visible policies. But you might think that people who had really gotten a lot of benefits out of the tax code would have more positive attitudes about it, but that was not the case. They were not more likely to think the system was fair. So despite the fact that they were getting extra breaks, for example, if you own a home and you get the tax break for homeowners versus renting, people didn't see that as being something extra for them through it.
But doesn't that come from the income distribution effect? I mean, the beneficiaries of the home mortgage deduction are differentially high-income people with big mortgages.
Yes.
And
no, that's true.
They're not so likely to think the tax code's just great because they're paying higher rates.
Yeah. Well, so it is true that these hidden policies, we do more of these for people who are fairly well advantaged in society, and people who are quite advantaged are better able, they're more engaged in the activities that allow them to take advantage of these kinds of policies than those who are less well off. But in doing this analysis, though, I also controlled for income.
She's a political scientist.
Income, education, age, and so on. And so now in recent years, I mean, the earned income tax credit is part of the submerged state, but it really helps low-income people very significantly. But there again, people who used that were only a minority of them said up front, yes, I've used government social programs. And it seems to have the same kind of submerged quality. So it's not, this doesn't come down to people's income levels. It really comes down to the design of the policies they utilize and how that strikes them about government's role.
Early in your book, you contrast the reception of Social Security after it passed in the Roosevelt administration and the reception of Medicare after it passed in the Johnson administration, both overwhelmingly favorable. I mean, Social Security remarkably didn't help anybody in the Depression because the benefits, as the people in this room know, but most people don't, didn't come in until 6 years after the enactment. But you contrast those two receptions, very positive, with the Obama administration's experience with the Affordable Care Act. You want to say a word about that?
Yeah.
And how it relates to the submerged state?
Yeah, exactly. Well, you know, I really got into this because during the first couple of years of the Obama administration, I was asked to do some analysis of what was happening with Obama's efforts in various social welfare policies. And so I was looking at healthcare reform and tax reform efforts and also at student aid reform. And in each instance, what I realized is that very different from Roosevelt. Roosevelt was, I mean, in governance, you've never really had a blank slate. There's always some existing policies that you're trying to work around. But sometimes there's more than others. And Obama really came into these areas with this agenda of things he was going to do where there's already a big entrenched system operating that had to be altered in some ways, if not done away with, in order to do something new. And when you're dealing with these policies that I call the submerged state, it's really complicated because in the healthcare arena, that meant that you have all of these vested interests, these groups, these industries that have benefited over time from the existing system, such as health insurance companies and the pharmaceutical industry and so on. And so if you're going to do something, you have to negotiate with them in order to do something new, and you've probably got to accommodate them quite a bit. So the Obama administration did that. They sat down at the table. They worked out arrangements. And then to a lot of Americans who had been excited about Obama during 2008, they started to feel disillusioned because they are saying, we thought he was the guy who wasn't going to be cutting deals. Well, frankly, if you're going to do something in contemporary governance, you really have to because of these vested interests that have a stake in what already exists. But to most Americans who didn't see that government already had this extensive role in healthcare, it looked like something brand new was happening.
And complicated.
Yes,
it
and
has to be
very complicated. Absolutely, yeah. We are into this time in our history where it's complicated, and it's not just though that it's complicated, it's also that so much of it is so hidden from public view.
Yeah. Let's pick up on that. You say that the submerged state undermines citizenship and has degenerative effects, these are quotes, on the relationship between citizens and their government. Those are strong words. Can you explain what you mean by that?
Yeah. Well, this is my biggest concern about these policies. So a lot has been written about how these policies are very expensive, like tax expenditures are now over $1 trillion a year, like 7% of GDP. Social Security, to put that in perspective, is 5% of GDP. Medicare and Medicaid combined, about 5% of GDP. So, this is a lot, and we don't tend to talk about it, even though it's very expensive. And it tends to be upwardly redistributive, as I've said, but that gets a fair amount of press. But what I'm mostly concerned about is its impact on democracy, because I think that the fact that most citizens don't recognize these policies as government social provision is really problematic in all sorts of ways. Because, as I've already been alluding to, it makes reform difficult. It makes people not aware, when they receive these policies, that government is actually doing something for them. People are not aware generally of the upward redistribution of these policies. And so it's really complicated to come in and reform them and to change them. And so we end up with government that's very expensive because, this is over $1 trillion a year, but where it doesn't have the effect of people saying, oh, well, government has really helped me in times of need and provided opportunities and so on as a result. So I think that really undermines the legitimacy of government in lots of ways for people. Because over time, if government seems really expensive but not very effective, it casts doubt on its ability to do much of anything.
Speaking of reform, and since we're at the National Academy of Social Insurance, let me ask you about social insurance reform. And these are benefits, clearly, that people pay for directly, or they think they pay for directly, so they feel entitled to them, which is why we did social insurance. But suppose they aren't fully paid for, or suppose the demographics change on us, or the cost of health care goes up faster than was anticipated, and policy has to be rethought. Then what happens to trust in government and confidence in government? Can you talk a little bit about that?
Yeah, wow, that's an interesting question. So I think that Social Security has been a policy with really a complex design, but an ingenious design. And Roosevelt was very purposeful about it when it was being created, that he wanted payroll taxes, and he said, so that no damn politician can ever take away my Social Security program. He knew that it would give people a sense that Social Security was their earned right. And so it does have those appearances of being analogous to private insurance because people have paid into it. And yet I think that most people also know at the same time that it comes from government. You get a check from government, so it's quite obvious. It doesn't come through this more hidden kind of a delivery system. So it's quite obvious to most people that that's the case. And so I think that's been an ingenious design. And I think that it's also, I want to mention one, what might seem like a small detail relevant to Social Security, but I actually think it's pretty significant. Over the past decade, people would receive, around our birthdays, we would all get these statements about Social Security and what our benefits would look like someday when we retired. Remember these? They've just been discontinued in the past year. And they were discontinued in the name of budget cutting and going toward more electronic forms of communicating with citizens. But what it means is that now, if you want to look at your statement, you have to take the initiative to go online and find it, which is going to be very different. I mean, that's going to mean that people who have a natural interest in Social Security are going to do it, but most people are not going to do it. And so people are not going to get that information. Well, there was a study that was done by Larry Jacobs and Faye Cook a while back, actually about several years ago. When the statements were initially introduced, they were able to do a natural experiment because some people were getting them and other people weren't. And so they looked at the attitudes of those two different groups, and they found that the people who'd been receiving the statements had a greater sense of confidence in the future of the program and that the benefits would be there for them than the people that were not receiving the statements. And it's one of these simple things that government can do to help people, to help cut through the invisibility and complexity of programs, and also, frankly, our political communication today, which has become so polarized, and people tune into whichever news channel they believe in most, and so on, so they hear different things. So if you have some simple things like that, you can cut through that, so it's a real loss that we haven't done it. So going forward, with Social Security, I think that its design will help it to endure some of these things longer than other programs might, because it has both the attributes of being tied to the individual, but also coming from government. But I think that you can never do enough to make programs more visible to people so they'll understand what benefits they are going to get out of them themselves.
I think the loss of those statements is considerable. We probably ought to get everybody in this room to protest.
Yeah, I think it's really important.
I also love the little letter that I get every year saying, "We notice you're still working." And we are increasing your Social Security benefit by this small amount. It's very gratifying. But come to Medicare for a minute, if I can pursue you on this question, because it's a hybrid. People pay in, but they're paying for Part A, and then they pay a premium for Part B, but they don't fully understand what that means, and it only pays for part of it, and most people don't know that. So it's very complicated. What should we do there?
Well, yeah, and I think it's also problematic that a good share of it is now channeled through private insurance companies, because then it's all the more complicated. Is it really a government program, or is it private? So, I mean, government gets a bum rap, I think, when it expends lots of resources but channels it through these private channels. And so, there was that famous little story that happened in 2009 at a town meeting where someone said, "Get the government out of my Medicare." And much was made of that. And I thought, well, maybe that was an individual whose benefits were actually coming through a private insurance company. And so he wasn't the fool that he sounded like, because you could legitimately be confused by that.
Just building on that, your submerged state isn't just about taxes. It is about contracted services and all of the things that the government does do through private channels.
Right.
But where would you draw the line? I mean, surely you wouldn't say the government shouldn't contract for some service that can be produced more efficiently in the private market than by the government itself. Where do you come out on that?
Yeah. Well, no, I certainly think that it's very American, and it's also very reasonable for government to do lots of things through private channels. One mistake we make, though, is always assuming that it's more efficient and less costly. And I was really surprised in doing the research for this book to find out how those assumptions can be wrong. For example, with student lending, which is one of the cases in the book, that gets outside of the tax system entirely. But from 1965 up until a couple of years ago, we were doing bank-based lending, where we're paying a middleman to then make loans to students. And this was reasonable at the outset to try to get more lending to happen to students, but then it got so that over time it was very lucrative for Sallie Mae and for the banks that were doing it. So there was the push for direct lending. And so that was finally became signed into law in 2010 and was rolled together with the Affordable Care Act. And so it actually scaled back what we spend, because we're not spending the large subsidies for the banks that we were previously. So it's not always more efficient to do that. But then besides that, I would say that what's most important to me is that we find ways to make it clear to citizens government's role in these policies. So even if we decide in certain areas that it makes sense to channel things through the private sector, that there be some way of making it evident what benefits people are receiving. So for example, I think that given the large extent to which we now channel social welfare policies through the tax system, that after we pay our taxes every year, we ought to get a tax receipt that would say on it the amount we got from each of these different benefits and make it clear what those amounts are, just in a very simple way.
Your student loan story reminds me of an anecdote shortly after the Clinton administration. I was at a business group, and an business executive said to me something about, "You socialists in the Clinton administration." And I thought, Clinton's a socialist? What? But then I realized who it was. He was CEO of Sallie Mae.
Yes. Oh, very ironic.
And now Obama's being called a socialist for equally poor reasons. Come to the current debate. I mean, here we are talking as a nation. Debate may be too polite a word on it. It's a lot of name calling. But central to the budget and debt issues that I've been very absorbed in are two things that you've been talking about a lot, namely tax reform and reducing tax expenditures, and entitlement reform. So these involve the submerged state in major ways. Yeah. So what would you advise the president to do?
Yeah. Well, it's challenging. And actually what I haven't had a chance to talk about yet, I've been talking a lot about how hidden these policies are to ordinary Americans. But of course, they're not hidden to the interest groups that benefit from them, who have been increasing the amount of money they invest in politics over time in real terms, in terms of the campaign contributions and the amount of lobbying they do. So their voice, in effect, in politics becomes louder over time in order to defend their interests, while citizens are really left out of this debate. And so what the president would need to do if he's going to, if we were to move forward with efforts to do tax reform that would really be scaling back more of the submerged state. First of all, of course, there's the effort for political communication. Now, political communication, as I was alluding to a few minutes ago, is complicated these days because we know that fewer and fewer people listen to political speeches like the State of the Union address annually. And people do tune in to their favorite news channel that's more partisan, and so they're just getting one interpretation, one look at things, and not others. But I did an experiment with Matt Guardino, a co-author that is part of this book, The Submerged State, that suggested something about the value that information can play in elevating people's understanding of these policies. So what we did was that we gave people just a little bit of information about various policies and a little graph. So for example, with the home mortgage interest deduction, we had a group where first we just asked them right up front how supportive they were of the policy. But then we had another group where we started out by giving them some information with just a sentence or two explaining that 69% of the benefits went to the top 15% of households, wealthiest households, and then show them a little graph indicating that. And what we found in the difference in groups was that people who got the extra information, for one thing, many more of them formed opinions. One of the things about the submerged state and a lot of contemporary policies is they seem so complicated that people are hesitant to even articulate a view on them. But with just this little bit of information, a whole lot more people were willing to take a stand and answer the question about their opinion. We also found that people then answered in ways that for them made sense, given their income or their political ideology and so on. So people who were low to moderate income were much more likely to be opposed to the policies that gave most of the benefits to the highest income people. Although, interestingly, when we looked at the earned income tax credit, we found that when you gave people this little bit of information, everybody across the board became more supportive of it, suggesting that you can actually build support for policies that help low-income people if people are more informed about what they actually do. So it suggests to me that we should, I mean, I think that there are challenges going forward with political communication given our very partisan environment, but that it can still be worthwhile to try to speak to the public and in very clear and simple terms about these policies and how they work. And frankly, when it comes to the submerged policies, most public officials barely talk about them at all.
Many of them don't know very much about them. It's time to throw this open to questions. There are 2 microphones. Please come up and ask your short question and identify yourself before you do that. And while people are coming up, let me just say one thing I found encouraging, and it was my experience, excuse me, my experience on Simpson Bowles, that Republicans are now willing to use the term tax expenditures. Senator Tom Coburn from Oklahoma was one of the most active members of that commission. Come on up to the microphones, folks. He talks very strongly about spending in the tax code. That used to be verboten. You couldn't say tax expenditures, or somebody would jump on you and say, it's not the government's money, it's your money. But now that has faded, and quite conservative people like Senator Coburn are talking about tax expenditures.
Wow. I'm interested to hear that.
So I had a comment, and maybe it's a question, about the submerged economy. The situation with home ownership is much more submerged than you have acknowledged. The advantage of home ownership is that your imputed rent is not taxed. Actually, the home mortgage deduction is perfectly appropriate if we recognize the income that comes from owning the house.
Yes, but we don't.
But we don't. So where the real advantage is that people, and particularly high-income people, have income that is not taxed in the form of imputed rent. And so, anyway, that's my comment, that it's not the home interest deduction that is the distortion, it's the lack of imputed rent.
Thank you. You want to comment on that, Suzanne? But it reinforces your point,
Yeah,
basically.
it's a great point, and it actually makes the argument all the more strongly. So, thank you.
Please identify yourself.
Anna Rappaport, an actuary. My question is about student loans and what contribution and how do you see the submerged economy having made contribution to the amount of student loans that people have and the way they finance college?
Yes, say a little bit more about the question.
Well, when people, and I don't know much about this at all, but I think when people fill out these federal aid packages and things, they sort of end up getting into student loans and don't necessarily understand it. And I guess I'm interested in understanding if some of these policies have encouraged more borrowing and have helped people get themselves into trouble with student loans.
Yeah, right. Okay, thank you. I think that the increased borrowing hasn't necessarily happened because of the invisibility of the policies. I think since student loans were created, tuition has gone up dramatically at all kinds of institutions. And it used to be, back in the 1970s, that the average student who was using student aid was getting more in grants than they were taking out in loans. But then those two reversed themselves in the 1980s, and then the amount of borrowing that people do to go to college has gone up and up and up ever since. thinking about this in terms of the submerged state, we were so long doing it through this bank-based system where we had a middleman, and now we've moved over to 100% direct lending by government. Although interestingly, so this was, if you think of this as, kind of a victory, you could think of it as a victory for visible governance, except that in the end of the day, as part of the agreement, when this policy went through in 2010, Sallie Mae and the other student lenders won the opportunity to do the servicing of the direct loans from government. And someone I interviewed in the Department of Education said to me, I said, now what will be the difference for students taking out direct loans versus the earlier kind? He said, from the point of view of the student, it's going to be exactly the same. It's not going to look different at all. And they're still going to be, dealing with the loan servicers. So, sometimes even when we make government more visible, we hide it at the same time.
Larry Polifka from Florida. In terms of the contracted out part of the submerged state, which is now a huge part of the government public-private relationship, the Project for Public Accountability, I think it's called, did a study about 1.5 years ago, and they looked at something like 38 contracts equaling over $300 billion. And they found that when you compared the cost of the contracted out program to what it was when it was still a part of government, that government was paying 2 to 3 times as much money for the same kind of services, mainly because of increased salaries. And it struck me at the time as I'm still looking for an example of where the government has saved money in contracting out services. Right. And this, to me, was the biggest study yet, indicating that we're, in fact, losing a lot of money with that operation.
Wow. Well, that's fascinating, and I was not aware of that study, so thank you for bringing it to our attention. I think we've been, over the past few decades in the United States, we've been in this time where, we talk about how it's a good thing to scale back government. We have this sort of value that's put out there. And we find when we do public opinion research that Americans sort of applaud those ideas in the abstract. When it comes to concrete policies, if you ask them about Social Security, people have very favorable views about specific things government does. But nonetheless, if you ask the abstract questions, you get the sense that people want government scaled back. And so we do a lot of that. And, fascinating to have evidence like this, that it's not always more efficient as it's purported to be. So I think, we're in this very confusing point in our history where we tell ourselves these stories, but they don't necessarily play out that way in reality. And that's what I felt that I was coming to grips with when I wrote this book.
Janice Gregory. I'm curious, I find myself curious about the 50% plus who said that they weren't receiving any or had not partaken of any government program. And then you go through and they find out that lo and behold, they have. Did your research look at any, did their attitude change in any way? Did your research look at that? Where, what was their attitude when they started, and what was their attitude when they found out they'd actually benefited somewhere?
Yeah, thank you for that question. I actually have with one of my co-authors, Juliana Koch, we've written a whole paper where we delve into who said no to this question about using government social programs, who actually had used them, and why did they say no, and so on. And so we found a few things. I mean, first of all, we did find that policy design mattered. So people were more likely to say yes if they'd used a greater number of visible programs than fewer, and they were more likely to say no, interestingly, if they'd used more submerged policies. That was interesting because we thought that would make no impact, but it appears that the more of these policies you use, the more confused you get, in a sense, that government is doing something for you. We also found, though, we controlled for other things, and political knowledge mattered. So people who have more awareness of what government does generally and know more about government were more likely to answer yes if they'd used some of these policies. And then political ideology mattered a lot. So people who defined themselves as extremely liberal were much more likely to say yes, and people who were defined themselves as extremely conservative more likely to say no, even when they'd use the same number of programs as each other. And there was also, this term government social program seems to, I think to many people, it's a pejorative term. And so we found that people who had negative attitudes about welfare were less likely to say yes to it as well. So several things play into it. It's not just the design of the policies, and ideology today matters a lot as well. Yeah.
Wei Wen-ung, I'm here just representing myself. The Affordable Care Act is a fairly visible, mostly government program, and yet there are some myths about it that just won't die, like the death panel's libel won't die, and I think there was one study that showed that education about the fact that there are no death panels in the ACA actually reinforce people's attitudes. So do you have any advice in terms of communicating to citizens about and undoing some of the myths that have spread?
Yeah, the Affordable Care Act. Right, so it is complex because, there are ways in which it expands the visible state through the expansion of Medicaid benefits, but then other ways in which it really expands the submerged state by giving more people private insurance coverage. So, going forward, there will be these challenges of communicating about it clearly. I'm actually, by the way, I'm involved in a research study with Larry Jacobs over the next many years. We started in 2010, going to people and asking them their attitudes about the Affordable Care Act, and we went back to them in 2012, and we'll keep going to them every couple of years for the next few years as implementation moves forward to try to look at what's happening. But there again, I think that delivery is really important. So one of the really small changes that was made as part of the Affordable Care Act is that W-2s going forward are to say on them the amount that employers pay for people's benefits for health coverage. Now, it's in part a question of how that's done, and does it make it explicit that this means you're getting a government benefit that's subsidized? It may not have that cognitive effect on people. But I think that not just political communication, but also those kinds of small aspects of policy delivery can help make it more evident that government has this major role.
Good. Last question, Pam.
All right, thank you. I'm Pamela Larson from the National Academy of Social Insurance, and these are such important ideas for those of us who are trying to help deepen the public's understanding of the programs. And I know we cajoled you into signing copies of The Submerged State right after this session in the exhibit hall, but I also know we interrupted you writing another book. Could you tell us about your next book?
Oh, that's very nice of you. Thank you. Yeah, and so I'm writing a book about higher education policy today, and why is it that, well, in the middle of the 20th century, we were doing a really good job in expanding access to college and college completion rates from the GI Bill right up through Pell Grants. We had all these policies that were doing that, and which, by the way, Alice has written about previously.
Long time ago.
Yes. So we were doing a good job then. We've done less of a good job in the past many decades. And it's not just a function of how much money we spend, because we've been increasing the amount we spend. A lot of it, again, is channeled through the submerged state. Tuition tax credits, for example, which have been increased quite a bit in recent years and are not so effective at expanding college access and completion rates. And so I'm in that book looking at what's happened with federal student aid and what's happening at the state level, and also the rise of the for-profits, which are, like the student loan industry was, an industry that benefits tremendously from government benefits, and I think which has been skewing our policies and our ability to really have better effects. So, thank you.
Thank you, Suzanne, for a very stimulating as Pam said, there are books available. And I've actually read this book, and it is a good read and not too long.
Thank you.